This Council now becomes Committee of the Whole Council to consider the Supplementary Medical Professions Amendment Bill 2025. Members may refer to the appendix to the script for the debate and voting arrangements for the bill. Members have been informed that the committee will conduct a joint debate on the clauses and the amendments, including the new clauses. I now propose the question to you that the following clauses stand part of the bill. Clauses 1 to 206. Secretary for Health will move amendments to amend various clauses and to add the new clauses. Members may refer to the appendix to the script for details of the amendments. Members may now proceed to a joint debate on the clauses and the amendments. I will first call upon the Secretary for Health to speak, but he is not required to move the amendments at this stage. Then I will call upon members to speak. Upon the conclusion of the joint debate, the committee will first vote on the clauses with no amendments standing part of the bill, then proceed to deal with the amendments according to the arrangements set out in the appendix to the script. Secretary for Health. Chairman, I now propose the government's amendments to the Supplementary Medical Professions Amendment Bill 2025. The amendments are made in response to the recommendations made by the Bills Committee to further improve the regulation of various allied health professions under the Supplementary Medical Professions Ordinance. The major amendments in the CSAs relate to the following four areas. The first area involves amendments to the existing arrangements for the operation of the SMP Council and the boards. The Bills Committee noticed that while the primary legislation provides that the chairman of a board has a casting vote in the event of an equality of votes, the subsidiary legislation provides that in the event of an equality of votes at a hearing of the board, the chairman does not have a casting vote and is required to give a decision in favor of the respondent. In view of the difference in the formulation of the arrangements for the casting vote of the chairman of a board, will amend the relevant provisions to the effect that in the absence of a casting vote of the chairman of the respective board at an inquiry, the board is required to decide in favor of the respondent in the event of an equality of votes. In respect to applying to restore names to the register, under the existing ordinance, the board may approve or reject the application subject to any conditions as it thinks fit. Having listened to the recommendations of the Bills Committee, we agree that the board should be empowered to conduct inquiries into the application to ensure that the application is properly scrutinized and to safeguard professional standards. Similarly, under the existing ordinance, if a person provisionally registered contravenes the conditions of his registration, the board of the profession to which he belongs may directly cancel his provisional registration. After listening to the suggestions of the Bills Committee, we agree that the relevant decision should be subject to the same inquiry as other cases of deregistration to ensure fairness and consistency. Regarding the handling of complaints and information concerning professionally registered persons, as the existing ordinance only allows the board to handle complaints but not information against registered professionals, it has to a certain extent restricted the strength of the board in regulating the profession. Therefore, we will introduce amendments to clearly reflect that both complaints and information against registered professionals can be handled by the respective boards of the relevant professions to ensure that the boards can regulate the industry more effectively and maintain the overall professional standards. The ordinance currently allows the council and the boards to transact businesses by circulation of papers without the need to convene a meeting. In response to the Bills Committee suggestion, we have taken the opportunity to propose amendments. That is, if a member requests to discuss a matter at a meeting, the matter cannot be passed by circulation. This is to ensure that the ordinance is in line with other legislations regulating the healthcare professions. The ordinance currently makes it an offense for a person to knowingly obtain registration or provisional registration by making any false or fraudulent representations or statements. In the light of the observations of the Legal Service Division, we will amend the provisions to clearly reflect that the same arrangement applies to the newly added limited registration and provisional registration. Also, the bill introduces new pathways for registration, namely limited registration and provisional registration. We will make appropriate amendments to the provisions on the supervisory conditions for various types of registered professionals under the ordinance, and the professional and the subsidiary legislation to ensure that the Council can impose conditions in approving applications for registrations. The third area concerns amendments to the direct access arrangement. One of the conditions for implementing the direct access arrangement for physiotherapists and occupational therapists included in the bill is that the services of an occupational therapist may be provided on a non-referral basis for the purpose of community service, as set out in the Code of Practice, including emergency situations. In response to the suggestions of the Bills Committee, we will clearly stipulate that the relevant Code of Practice should set out each and every actual situation in respect of emergency and social and community services. This is to protect physiotherapists and occupational therapists from violating the requirements of the Code of Practice due to misunderstanding. The fourth area involves consequential amendments to other legislations, with the aim of ensuring consistency between this ordinance and other legislations. With the passage of the Dentist Registration Amendment Ordinance 2024 in July last year, it is stipulated that local dental graduates and non-locally trained dentists who have passed the licensing exam will be required to undergo a period of internship or assessment in the provisionally registered capacity before they can be formally registered. And the services that dental hygienists and dental therapists can provide after they are registered will expressly include the taking of radiographic photographs of the oral cavity, and the provision of services to be provided by them after they have been registered. The services that dental hygienists and dental therapists will be able to provide, these services will be covered under the bill to tie in with the commencement of the assessment period and the commencement of the provisions. We have consulted the Radiographers Board. Apart from the above four areas, we have proposed other amendments, which are all technical in nature, including improving the wording of the provisions to ensure consistency. These improvements are very important in ensuring a stable supply of healthcare manpower in the public healthcare system and the development of primary healthcare. The bill and the amendments are the fruits of the consensus reached among stakeholders from different sectors, which are not easy to come by. The current amendment exercise is the starting point of the reform of the allied health sector. We will continue to listen to the views of various stakeholders to ensure that the ordinance will continue to keep abreast of the times. I hope members will support the amendments. Thank you. Does any member wish to speak? If not, we now first vote on the clauses with no amendment standing part of the bill. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. This committee now deals with the clauses with amendment. Secretary for Health, you may move your amendment. Chairman, I move the amendment set out in the appendix to the script. I propose the question to you that the Secretary's amendment be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the amendments passed. Clauses 1, 5, 12, 14 to 17, 19 to 21, 26, 27, 29 to 33, 35, 36, 40, 47, 63, 65, 69, 76, 92, 96, 106, 123, 134, 146, 152, 153, 155, 159, 166, 182, and 188 as amended. I now put the question to you that the clauses as amended just read out by the clerk stand part of the bill. Will those in favor please raise their hands? Those against please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. We now deal with the new clauses. New Clause 12A, Section 8 amended, Transaction of business by circulation of papers. New Clause 19A, Section 15AB added. New Clause 30A, Section 27 amended, Penalties. New Clause 187A, Regulation 2 amended, Interpretation. New Clause 188A, Schedule 3 amended. Secretary for Health, you may move the second reading of the new clauses.
Chairman, I move the second reading of the new clauses just read out by the clerk. I propose the question to you that the new clauses read out by the clerk be read the second time. I put the question to you as stated. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. New clauses 12A, 19A, 30A, 187A, and 188A. Secretary for Health. Chairman, I move to add the new clauses just read out by the clerk. I propose the question to you that the new clauses read out by the clerk be added to the bill. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. All the proceedings on the Supplementary Medical Professions Amendment Bill 2025 have been concluded in Committee of the Whole Council. Council now resumes. Secretary for Health. President, I now report to the Council that the Supplementary Medical Professions Amendment Bill 2025 has been passed by Committee of the Whole Council with amendments. I move the motion that this Council adopts the report. I now propose the question to you that the Secretary's motion be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed.